What is meant by cervical cancer? Cancer is the name of the disease in which the cells of any part of the body grow uncontrollably, and the cervix is a lower, narrow structure that connects the female vagina, birth canal, to the uterus. The growth of small cells in the cervix could lead to cervical cancer. It occurs after the age of 30. Cervical cancer develops gradually. Before cervical cancer, the cervix experiences some changes in its structure, where small abnormal cells appear in cervical tissues. This condition is known as dysplasia. When these abnormal cells are not treated on time, they start to grow more deeply into the cervix and nearby areas, and could cause cancer. Pain may not be felt at an early stage. When it leads to further developed stages, then the affected person may feel pelvis pain. How many types of cervical cancer exist? There are two main types of cervical cancer. Its name indicates the position or type of cells where cancer occurs. These are squamous cell carcinoma and adenocarcinoma. Squamous cell carcinoma. When cancer occurs in the ectocervix part of the cervix, then it is called squamous cell carcinoma. 90% of cervical cancers belong to this type. The ectocervix is the outer region of the cervix. Its flat and thin cells are known as squamous cells. Adenocarcinoma, when cervical cancer develops in the endocervix epithelial cells, it is known as cervical adenocarcinoma. The inner part of the cervix is known as the endocervix. This part forms a small tube that connects the vagina and uterus. The cells of the endocervix are glandular and form mucus. The part where these two parts of the cervix meet is known as the squamocolumnar junction. Most cervical cancer occurs in this region or zone. There, it is known as a transformational zone. If cervical cancer contains both types of features, then it is called mixed carcinoma. Describe the stages of cervical cancer. Cervical cancer consists of 4 stages. Stage 1. At that stage, cell outgrowth is limited to the affected person's cervix and has not spread to side parts. Stage 2. In this stage, cancer spreads out of the cervix and uterus, but yet away from the pelvic cells and vagina. Stage 3. At that stage, the cancer cells may reach the ureter, which is lower than the vagina, and could even spread to lymph nodes. Stage 4. This is the last stage of cervical cancer, in which the abnormal cell development even spreads up to the bladder and rectum. Sometimes, it spreads to other parts of the body, like bones or lungs. Is cervical cancer common? Cervical cancer is the most common cancer in women globally. 2022 report reveals that almost 660,000 cases have been reported, out of which 350,000 lead to deaths. This rate would decline due to screening and vaccination. It is more common in women aged 35 to 44. Do you know the cause of cervical cancer? The first cause of cervical cancer is similar to other cancers, its own cell's DNA instructions. The healthy cell's DNA of the cervix changes, and it starts to send messages to cells to develop more. At that level, when healthy cells die, new cells begin to grow, but at an abnormal level, they form in bulk form, sometimes known as a tumor. These cells then can invade healthy cells or can destroy the nearer healthy tissues of the body. The second and foremost cause of cervical cancer is HPV human papillomavirus. It transfers from person to person through sexual contact. This virus exists in most people, but it goes away on its own. In rare cases, it leads to cancer. This virus causes changes in the cells of the cervix, which then starts to produce abnormal cells. Who is at greater risk of getting cervical cancer? Women with sexually transmitted infections caused by human papillomavirus are at a higher risk of getting cervical cancer. Women with human immunodeficiency virus also have a higher chance of getting this cancer. Similarly, those who are infected with human papillomavirus or chlamydia also have higher chances of getting cervical cancer. Describe the symptoms of cervical cancer. The early stage of cervical cancer usually does not show any symptoms, so it becomes hard to find it. It may take after passing several years with cervical cancer. Cervical cancer symptoms appear differently at different stages. The affected person may experience bloody or watery discharge with a foul smell through the vagina when just abnormal cells develop into the cervix. This vaginal bleeding could occur after menstruation, menopause, or after intercourse. Periods may be heavier than normal and last longer. When cancer spreads to nearby tissues, it evolves other symptoms, which include pain during urine or blood with urine, rectum bleeding, diarrhea, loss of appetite, dizziness, the feeling of illness, swelling in the legs, and abdominal pain. How is cervical cancer diagnosed? Just like other cancers, cervical cancer develops gradually, even over the years. As we have discussed earlier, before reaching the stage of cancer, cells of the cervix go through changes. Once normal cells change, it causes abnormalities and leads to cancer. Firstly, a normal screening test would be taken by a doctor. The screening will include a pop test or pop smear, in which some of the affected person's cervix cells will be taken. These cells are then examined to detect any precancerous cells. When the result of the pop test becomes abnormal, further testing is recommended. The extra test is an HPV test. A special type of HPV is linked with cervical cancer, so this test is mandatory. After HPV confirmation, the examiner can take a biopsy of cervix tissues. Many techniques are used to take the tissues, such as a punch biopsy. When this test result confirms cervical cancer, then the doctor will take further tests to determine whether this cancer has spread or not. This test includes a kidney test, a blood and urine test, and an X-ray of the bladder or rectum. What is the treatment process for cervical cancer? Several treatments are available for cervical cancer. An infected person and a cancer team collectively decide which they want to adopt. Many factors should be taken into consideration, such as the stage of cancer, overall health, lifestyle, and others. Treatment may include radiation, chemotherapy, surgery, targeted therapy, and immunotherapy. In radiation therapy, an energy beam is used to kill the cancer cells. There are two ways to do this therapy: external beam radiation therapy and brachytherapy. In external beam radiation therapy, powered radiation is used through a machine from outside of the body. In brachytherapy, radiation is put inside the body. In chemotherapy, some drugs are recommended that are taken orally to kill the cancerous cells. These drugs actually enter the blood and are effective for any cancerous cell. These drugs are given in cycles, which vary depending on the type of cancer. Several methods are used in surgery treatment. In laser surgery, the laser beam is used to burn cancerous cells. Other methods include cryosurgery, in which cells are frozen, and cone biopsy. In immunotherapy, some medicines are recommended by your doctor that stimulate the immune system, and identifying the cancerous cells destroys them. Some people adopt diet, herbal, or other supplementation methods to treat their cancer cells. Is there any vaccination against cervical cancer? Yes, the HPV or human papillomavirus vaccine has been approved for children as well as adults. Adults ages 9 to 45 can take this vaccine. This vaccine triggers the immune system of the body, which attacks HPV. The vaccine should be taken in series. The number of vaccine doses depends on the age at which one takes the first dose. Before vaccination, try to visit your health consultant to learn about eligibility factors. Can cervical cancer be prevented? Here are some things to adopt that could prevent cervical cancer. Take regular gynecological exams and pop tests. Get the HPV vaccine. Use a condom while making sexual contact, and stop smoking and tobacco items. Can cervical cancer affect someone's sex life? Yes, it can impact the sexual life of a person. The affected person can experience some physical and emotional changes in their life after treatment. Vaginal dryness or ovary removal can affect the life of an affected person. Can a man give a woman HPV? HPV is spread only through vaginal, anal, or oral sex. An individual with HPV can pass it to someone who has no signs or symptoms of this disease. If you enjoyed this video, don't forget to like, share, and subscribe to our channel for more captivating content. And as always, stay curious and keep exploring.